Supply chains for drugs are vulnerable in Germany and Europe as a whole, and that was true even before COVID-19 broke. Shortages point to systemic problems and more often than not involve China. There's a federal agency in Germany that's responsible for dealing with any shortages of drugs. Germany's powerful health insurance funds strike favorable price deals with producers at regular intervals and in return promise the pharmaceutical companies involved to buy certain drugs from them only. For many producers of drugs, Chinese supplier soft basic active ingredients play a pivotal role. This has led to lower prices for health insurance funds and patients alike. But cost pressures for producers are enormous, so that the latter feel inclined to relocate production away from home where labor costs are high. The last big Germany-based producer of antibiotics, for instance, was closed down some 2 years ago. Supply chains under scrutiny. Producing drugs is anything but plain sailing and can take up to 14 months. Sometimes the only thing that happens in that process in Western Europe is getting the drug sent to blister. The medical active ingredients, however, often come from faraway China. China's COVID-19 struck Hubei province is home to producers of agents for 136 drugs including antibiotics, according to the German Pharmaceutical Industry Association, BP. Though supply chains are well organized, they can be vulnerable if there are outside pressures over a longer. Not so long ago, it admitted that 239 drugs were not available across the nation at all. Shipping goods from, say, Shanghai to Rotterdam takes about 4 weeks, so the impact of any problems is not felt immediately. Moreover, suppliers usually build up a stock of 3 months' supply for emergency situations, as Axlamol from Intergenerica in Switzerland. Consequently, says French pharma expert Eric Buteler, a major problem only arises for Europe when the supply chain is interrupted for half a year. The Roland Berger consultancy told DW that the lack of supply chain transparency could turn into a problem during the coronavirus crisis. If the situation doesn't get any better, stocks of active ingredients will melt down in China and India, too, meaning supplies to domestic markets will take. Facing the current coronavirus crisis, BF Arms spokesman Mike Bemay doesn't want to meet trouble halfway. He says that Hubei province is not relevant for drugs that Germany did. Well-stocked pharmacies help patients feel safe in Germany, but drug shortages have recently made headlines. Lessons to be learned, be that as it may. Pharma firms and wholesale traders will now have to report any shortages to the federal agency in line with fresh legislation. It remains unclear, though, whether the agency will also be allowed to ban the export of hard-to-get medications, as some keep demanding. But that was in October of last year, at a time when most people had probably never heard of a thing called coronavirus and didn't know where Wuhan, China, was located. The current system often sees such drugs shipped to other nations, as many are cheaper in Germany than in many other nations, and traders cash in on the price difference. But it cannot be ruled out that exactly those drugs are not there when German hospitals and private households need. This is what Frank Dorje, who runs a hospital-affiliated pharmacy in Erlangen, calls systemic. The coronavirus epidemic will certainly trigger more debates on how to deal with drug shortages, or rather how. Germany's environmentalist Greens, for instance, suggest in a policy paper that incentives be created to bring the production of some active ingredients for drugs back home. There's no answer yet as to how exactly this could be enforced. Since Facebook, Twitter, Google+, WhatsApp, Tumblr, LinkedIn, StumbleDig, Reddit, Newsbeam, permalink, p.d.com/p/3 Britain faces a shortfall of everyday essentials if it leaves the European Union without a transition deal, a new leak through. Some lawmakers are demanding Parliament barricade to discuss a no-deal Brexit. 18.0 2019, producers in China supply lots of medicine ingredients to pharmaceutical companies. Right now, the Federal Institute for Drugs and Medical Devices, BfArM, lists a total of 277 drugs that are hard to get. So what happens if the coronavirus stops production there? Activists say Iraq's political system is the real virus, without a political deadlock. Violent repression and decades of corruption all outweigh fears of a transfer of coronavirus from. California has reported its first death from COVID-19 and declared a state of emergency, while figures show more than 3,000 have died in China since that. All the latest from DW here. Among them common drugs such as antibiotics, painkillers and antidepressants. The shortages at hand could easily become a lot worse, and it doesn't necessarily take a coronavirus to exacerbate the problem. Dependence on China. The figures pointing to that dilemma were out for everyone to see before COVID-19. Some 90 of active ingredients used in generics are Producidine. Generics are patent-free drugs. But even some 50 of drugs protected by patents are made with the help of substances from China. Increasingly, it's not just active ingredients but generics themselves that are being produced in Asia, including India, but production is also being outsourced to